All right. Item 1C, approval of the agenda.
Move to approve.
I make a motion to, you want to change which item?
I'm sorry, I have a motion to approve. Is there a second?
Support.
Now, we have motion to approve and support. Do we want to amend that agenda?
I'd like to make a motion to amend the, group, or the minutes, not the minutes, the agenda.
And what do you want to do?
I want to move what line items?
Number four.
Number
Four.
I want to move number 4 to the number 3 slot.
Oh. Today.
Just gotta get
Part
there.
of the amended.
Dr. Luparella is getting ready to fly the coop, so.
Fly the coop.
Who else should do that?
Commissioner
We
Lane,
have,
do you wanna,
we have a motion and a second to amend the agenda. All those in favor of the amendment, say aye.
Aye.
All those opposed, the amendment passes. Now we have a motion to approve the agenda as amended. Any further discussion? Hearing none, all those in favor say aye.
Aye.
All those opposed, motion carried. Approval of the minutes of the August 24th, 2023 Board of Health meeting.
make a motion, we approve the minutes as presented.
I'm gonna support it.
Thank you, Jeff. Good. I appreciate that.
Have a motion from Commissioner Hoffman, support from Commissioner House to approve the minutes from the August 24th Board of Health meeting. Any further discussion? Hearing none, all those in favor say aye.
Aye.
All those opposed, motion carried. Number 2, public comments. Do we have any public comment this morning?
Ashley Ellsworth did send a written report. She can't be here. Do you want to wait until the AAA report?
We'll wait for that, yes. Okay. No public comment. Moving forward, medical director's report on page 8 of our packet.
Thank you. Thank you for switching the agenda, although I left myself time. I'm actually heading to Parents Weekend at the Coast Guard Academy, so I was thrilled with that. And then my mom's struggling a bit, so we weren't stopping there. We were headed straight to Connecticut, but now we're going to stop in New Jersey first and then Connecticut. So I can at least say hi to my parents too, which will make me happy for the weekend. So you can see my medical director report, pretty similar to previous months, although I'm still taking the firearm safety class through University of Michigan. Very valuable class. It's kind of goes through history of firearms and injuries and ways to prevent injuries and et cetera. And it's for some continuing medical education credits. So when I finish, I'm going to talk to Chris Dewey and we might roll that out to providers in the community, whether or not we like the class. And the tests are actually pretty rigorous. So, and it's a lot of hours. So they might want it, they might not want it, but at least if I took it, then I can give my opinion on the class. Chris has also worked diligently on a lead presentation for the providers in Sturgis and Three Rivers. And we're doing that next Thursday at noon. For Three Rivers Family Practice Group, and MDHSS is actually going to virtual in, give a little presentation on lead. I will be there, and I think they have 7 to 15 providers right now, somewhere in that group, that think they're going to make that meeting too. So I think that would be valuable and a good outreach since we've had that lead issue in the community. And then the rest is pretty much the same. My capstone project this semester is on human papillomavirus vaccine hesitancy in rural communities, and kind of at the beginning of my research for that. So I have a literature review due on Sunday. So that's done. Just gonna hit the send button when I'm away. And that's been actually a really good process as well. So I think that will bring some valuable information back to our communities too, because we definitely have vaccine hesitancy. Our numbers for human papillomavirus vaccination are pretty low in our communities. And, you know, there's a ton of research on why. So it's an interesting, I don't know if you've seen some of the some of the literature and some of the social media stuff on human papillomavirus. So if you have a child in that age range, like 9 to 14, your provider starts talking about it. It is an amazing, efficient, safe vaccination, and yet it got some very bad PR. So there are lots of parents who are pretty hesitant because of what they're reading on Facebook and social media, even though those are not very scientific, right? And then there's this group of families that feel like that gives kind of permission for sexual activity for their children, even though that is not at all what that vaccine is about. So that got some hype on Facebook and other social media events. So very interesting vaccine because it really does prevent cancers, you know, in men and women. So we started marketing to young ladies, but young men should really be getting that vaccine as well. So interesting. So I just today to talk a little bit about lead because we've had all of our lead stuff going on in Three Rivers, and most of the research on lead and all the data on lead is children oriented because those are the ones that have problems from lead exposure. So the CDC estimates about 500,000 children in the US with lead levels above what we call the lead level reference. And the lead level reference has sometimes changes as well, as we saw with testing of the water. That level can change, and then it bumps a lot of people into the dangerous area. So Medicaid has required for quite some time that we test all kids at 12 months and 24 months. And if they miss that testing, then we have ways to test them later, at least once. On my call this morning, they were talking about a lead mandate testing that will make that a requirement for all children, and that will probably come in January. So another expensive endeavor, right? But maybe necessary. So there's a push for that. It's kind of going through all the House and Senate right now, and there's been some support from some people, less support from the public health community because it's going to be a lot. I mean, it's already a lot, and it's going to be a lot more. So lead mandating testing will be something we might have to figure out how to do. So exposure comes when kids touch the lead, breathe in the dust from the lead, swallow the lead. We've heard of those old homes where kids are eating pink chips. And then unfortunately, it causes pretty significant damage to their nervous system. So they have delayed growth, delayed development, intellectual difficulties, learning and behavior problems, hearing and speech problems. So in order to protect those kids, we've paid attention to old homes. So those homes built before 1978, that was the year that lead-based paints were banned. So if you've lived in a home like that, if your child stays with their grandparents pretty often, lives in an old home, that's concerning, of course. We've learned through the water issue in Three Rivers that certain water pipes can contain some lead. So we see that leaching into the water system, and then we drink it and use it for our food products. It can also be found, unfortunately, in some child toys and jewelry. And those industries are kind of taking a better look at some issues with that. And you can see it in candles, sometimes some home remedies that people use to get rid of things. We'll start to talk about some homeopathic things, and there'll be some lead, a low level of lead. But if you use it frequently, that's a problem. Kids that have parents that work in industries where lead exposure is frequent, like stained glass, they can bring that home to their children, the dust, and the kids can inhale the dust or eat the dust. And then, interestingly, I didn't know this one, children who live near airports can be exposed to the air and the soil from aviation gas, which can contain some lead levels. So we, through federal and state programs, there are programs too. If you live in a home with lead, you can go through your state or the federal program for some lead safe home programs, lead protection fund. So there is some help available, but the biggest thing is to mitigate the exposure. So you want to get those kids away from the exposure to lead. Adults are slightly different. So because we're not in those formative years to acquire some intellectual disabilities, adults will get problems with their kidneys, with their lungs. They can have cardiovascular problems from lead. They can get like a headache, feel pretty run down from lead exposure. So same thing, we check lead levels, and then we watch where they're going. So again, we talked, I think at the last meeting, that some people were showing up in Three Rivers asking to have their lead levels checked. And we did allow that just because we felt like it was a good public service outreach. I haven't had any of those come back with high levels blood wise, so that would have to be kind of a long-term exposure, or they already had a high lead level and then the kind of exposure to the water might have bumped them over. So we haven't had any issues there, but I still think if people want a baseline, that's a very good thing, especially when we've had this issue. So I just thought I'd talk about lead since we have brought it up the last several months with the Three Rivers.
Here's the stack of candies with your reach.
I know.
I was trying to
Oh,
you're supposed to put candy.
Candies had some low levels of lead. I'm like, it's scary when you think about the fact that, you don't even know it's there. Some jewelry still has lead in it, so scary.
Any questions for Dr. Lucarello?
Mr. Chairman, I have a question, Dr. Luperlo, our commissioner from St. John's, Mr. Baker mentioned sweetness. How do they get into the?
I don't have a good answer for that. It kind of said old candies, so if grandma's pulling the candy out of her purse, maybe stay away from that. I guess that the FDA would kind of control. They would control that.
Can you imagine it's those orange ones that
Those-
they get out at Halloween
Maybe
that nobody likes?
candy corn. Is
Yeah,
just
that's
eating them.
fine. Yeah, that looks like it's got lead in it.
Don't make those anyway.
They seem to be heavy.
Yeah, it's a little bit heavier than-
Density or-
So, do you have any information available from the American Dental Association about amalgam in your teeth?
I
Because
don't.
they still use amalgam,
You do.
and that it has been identified as a heavy metal,
It has.
and yet they're still using it in teeth.
Yeah.
And I am a first place eyewitness to what happens when that stuff has effect. My wife went through it, and amalgam in your teeth, when it gets into your system, causes effects the same as a stroke. And, trust me, it cost me 10 grand to get the amalgam out of my wife's teeth. Interestingly enough, we went to a dentist in Milan, and when they remove the amalgam from your teeth, they have to isolate the tooth completely from every part of your body. And then they go in and grind it out, take it out, whatever they can. And once it's removed in a container, they have to call hazmat and identify that they have amalgam in their facility. Hazmat comes out with a dressed up team like nuclear scientists and carry it off. However, it seems to be okay to put a filling in your mouth as an amalgam. As long as it's in your mouth, it doesn't seem to be a hazard. But once you take it out, it's a hazard. And I wondered if there's anything at all about it.
I didn't read anything, but I will certainly do some research on it.
It's very interesting
Is it
that the American, yes, the
You're walking
American
around with it
Dental
in your.
Association refuses to identify that as a heavy metal. So,
Is that commonplace for them to use?
yes,
Is it?
yes. Yep.
We're all
And
wondering.
Just,
Feeling-
just,
I'm all kind of feeling it right now.
and just from my experience, I thought for sure I was gonna lose my wife to a stroke. And it took a lot of research to find out what was causing
Who's
it.
actually doing it?
Yep.
That's interesting.
Any other questions?
That's a call today, I think.
Yep.
All righty.
Thank you so
Yeah,
much.
thank you,
I'm
Dr.
sorry
Thank
for
you,
running.
Careful on
I
your-
will look. Thank you.
What year?
He's a junior. It's a 2C, they call it. He's a junior, so he's got a little more freedom. He has a water polo game on Friday nights. I'm excited to see that because we don't get to do that often.
Yeah.
Her daughter might meet us too, which will be nice. I'm not counting on it, but she's supposed to drive down for me and meet us, so that would be lovely. Well, thank you very much.
Take care.
Take care.
She's gonna be happy sitting out in the parking lot. Thank you.
All right, moving on, health officer report.
All right, good morning.
Good morning.
So, lots of stuff here on the first page, but I wanted to start by talking about a new CDC infrastructure grant that MDHHS is awarding to all of the health departments in Michigan. We don't know a lot about this grant yet, but we do know that it's fairly flexible funding, and we have a 4-year period in which to utilize it. What we have indicated to MDHHS we would like to do in year 1 is some infrastructure improvements to the Hillsdale building, which would include painting and carpet replacement and drinking fountain upgrades at all of our locations to move from the old style of drinking fountain to the newer water bottle fill, which still has a spout, but has a water bottle fill station. Those contain filters in them, which will be nice, at least in our Three Rivers building, where we know we need to provide filtered drinking water to individuals that use it that way. Our Hillsdale building, we decided to start there because it does need a little love. It's been quite some time since there's been some upgrades to the interior of that building, with the exception of the MCDC suite. So we are going to spend some time making some improvements there.
Rebecca, can I ask a real quick question?
Mhm.
So we just approved the amount for the elevator at Hillsdale.
Mhm.
Can we use any of this money to go towards that? Or is that already,
I think we might be able to.
I mean, that could save us some money, right? Because we're talking about taking that out of general, or not general fund, but capital improvements.
Yeah, and we've already paid the half down on that.
Okay.
So, but I would think that would potentially be an expense that could be covered under this grant. Although we didn't write it in our first year, so maybe not. We would have to amend what we wrote.
Just an idea.
That's a good idea.
See if we could
It
use
is a good
that.
idea.
Because we're talking about trying to keep that buffer on the Hillsdale capital improvements, and we're kind of eating into it. Maybe we could use this grant to go a little bit to offset that.
Good suggestion. All right, so that's that. I did go into quite a lot of conversation here about funding. As you know, on the agenda today, coming back is the conversation about a local appropriation increase. And so I spent some time talking about the ELPHS funding that was appropriated by the state legislature, the additional funding that is intended to bring the state closer to their 50% cost sharing piece that's required in the public health code. We still don't know what that looks like for us. We certainly anticipate an increase. We just don't know how much it could be. And there could be decreases in some programs, but increases in others. Again, we just don't know yet. We were told that we would probably know on 10. So soon, hopefully soon. So we asked again this year for a 15-cent per capita increase in local appropriations. And we're continuing to ask for that because our local appropriations are still behind the 50-50 part that's required in the public health code. It is our most flexible funding. The funding that doesn't come with ear tags, can only be used for this. These are the funds that allow us to really be able to grant all of our staff raises and things like that. So we continue to ask for this, that, and I keep sharing with you that the agency took really huge local appropriation cuts between the period of 2009 to 2013. We have reduced our staff by almost a quarter from the time that I started working here to where we are today. And that's because we don't have that flexible local funding to be able to keep those staff here. So what that has done then is made it even more difficult for our staff to do their work, because they're being asked always to do more. That additional funding, if you were to appropriate it, we would continue to use to look at where our shortfalls are, where our understaffing is, continue to work on bringing our staff wages up to par with what our compensation study showed us in 2019. And we just finally, with this last year, made it to the 2019 recommendation by the compensation study. And so now we're 4 years beyond that, which means we're still far behind, right? We have made increases and we appreciate every bit of that you have seen to do. But we need to continue to work to address our staffing pay so that we can attract the best and brightest and keep them here. I also point out that a lot of the COVID money that we got over the pandemic made it difficult for us to utilize our other grant funding. We were very conservative. Especially early in the pandemic, we did some layoffs because we didn't know at that point what COVID funding might come our way. We then did learn about COVID funding, but we were very careful to bring on people that we thought we could keep busy and successfully sustain. And we wanted to make sure that we didn't go over budget. We need to tap into fund balance and also do what we've done to, make promises to the board to try and keep our fund balance at a particular level. So if you look at the money that would be considered in our fund balance, it looks like we're just really healthy. But a lot of those funds are earmarked. And Teresa did put together a paper today, and I'll let her talk about that piece. If you want her to talk about it now, that's fine. If you would like to wait until we get down to new business, that's fine as well. But we again today are hoping that you will consider the increase in local appropriations. Thank you. All right, so our agreement with Hillsdale Hospital on use of the mobile van, the hospital is still working on what they need to do to make the mobile van a recognized rural healthcare facility. So they are not using that at this time, and we're still looking at, or they are telling us, December or maybe even early next year for a start date. Public health concerns, want to give you a couple of updates there. The Three Rivers action level exceeds for lead. There have been over 1,000 filters distributed by our agency in the city at this point. We continue to message to city residents on the availability of those and if they have concerns, what they can do and where to go. Regarding COVID, we are working on doing like a fall newsletter or fall update to superintendents in the 3-county area that isn't just focused on COVID, but focused on communicable diseases as a whole and other clinical services that we provide to schools. And we want to take that time in that fall newsletter to talk a little bit about COVID and some of the confusion. We will continue to use what is recommended as best practice by the Center for Disease Control. And when people call us and say, well, what should I do? We're going to point to those best practices and provide that information also on our website. There is certainly an uptick in COVID cases right now. I don't know if you're seeing it in your own home or amongst your friends and others, but we are seeing it here. We've had a number of staff with COVID that have been out and new ones that we're learning about every day. So there's certainly a lot of COVID going around. And what we're doing about that is trying to continue to message on the free testing supplies at our kiosks, the local libraries that are participating. Just this week, they announced that you can order free test kits again from the government. And that information is available. We are transitioning to the new COVID vaccine Of course, that means we're moving to a commercial market. Callie is in the process of trying to get that commercial private stock, as they call it, ordered. It's a little bit difficult with Moderna, a little bit easier with Pfizer, but we're working on getting that in. And we do have some of the new vaccine that's available for the vaccine for children in what's called the Bridge or Adult Vaccine Program in-house. So individuals on Medicaid, we can take care of them all. And that's, I guess, really all I have to say about COVID. Today in your agenda, we're asking that you approve an expenditure of grant funds to pay for indispensable supervisor training. And that went through the Finance Committee. Also asking for you to approve a vaccine pricing policy so that we have a formula in place that will allow us to be flexible. As we bring a new vaccine on, we can utilize the formula without having to always bring you an updated vaccine pricing policy or pricing sheet. We can certainly continue to keep you informed of that, but if we have a formula in place and the formula tells us how to price these, we're more flexible and can move faster. So for example, there's a new RSV vaccine and other vaccines that will, like the COVID vaccines, that we need to be pretty responsive on so that we know what to charge. Opioid settlement funds, those will go before the commission meeting in October at the Hillsdale County Commission. It appears likely that they will approve the $10,000 request for their county. And it's my understanding that the branch in St. Joseph County administrators have been made aware by Hillsdale County of what's going on. So we're hopeful that all three counties will appropriate $10,000 towards an opioid project by our health education team. All right, offices, nothing new for Coldwater to report. We did do the half down advance to Schindler for the elevator. Sturgis, the construction on the expanded space is complete. We're going to begin utilizing that next week. We have equipped the space with all the necessary furniture. Three Rivers, construction on the gable ends and the eaves is finished. Materials used really look nice and should provide us with a lot of service with maintenance. Thank you.
Just for planning purposes, look at doing something to that exterior in Hillsdale.
Mhm.
And, you know, because I'm sorry, but whoever had this idea of putting wood up on the gables and soffits a long time ago should have their head examined.
Well, one of the projects I'm hoping to target with this CDC infrastructure grant is that I didn't write it into the first year of the grant because I don't have time to get bids for it before I had to have the grant submitted. So
It's on the radar. It's just not a
Three Rivers,
new one.
Three Rivers, yeah. So
It's Hillsdale.
they gave us only
They
10
did
days.
they did the same thing over in Through, you know.
Or they're in the way.
Three Rivers looks good. We were over there just the other day and it looked really good.
They gave us only 10 days to determine and write a grant for what we were going to use that CDC infrastructure money on. So we really didn't have time to get bids for anything. So we had to go very general on that.
Like Riley gets this.
All right, any other for the health officer at this time?
I just gotta say, the meeting the other night, community health center, they're gonna have a Narcan machine put out there, and they can go get Narcan. Machine, they use for their family. So,
That is awesome.
as far as swim boats, bring that machine up.
Can I get- Yeah, and we'll maybe wait to talk more about the fund balance and stuff when we get to that. Request for the county appropriation. Any other questions for the health officer at this time? Mr. Matthew.
Thank you, Mr. Chairman. Thank you, Ms. Burns, for the report. I know we will be touching many of these areas you already mentioned. However, you have indicated earmark and also unrestricted funds. And about then the local appropriation, which Mr. Chairman later you will.
Yeah, we'll talk about that later.
But I have another question is, perhaps I just want to touch is, the other day in our board, there was a request for appropriations. I thought that, not only I thought, on July 27th, our board decided we will address that issue today. So I would like to know who approved, put that motion into our Branch County Board of Commissioners to approve or disapprove.
I'm not sure how that, how the decision was made to bring it to your county commission. But I did receive a phone call from Administrator Norman about that and explained to him that it was coming to you today. And that I expected that this board would make a decision today. And so that's what I know.
Mr. Chairman, I have very grave concern because we as a board, we are responsible for the leadership of this organization. And July 27th, the board said we will address the issue today. However, I do not know St. Joseph or Hillsdale they received or not. We had a motion came in, lack of second, it died. But my concern is without our approval, how can we asking other counties and institutions? We are here we are the watchdogs. So I need a reply from, written reply from Mr. Chairman, the health officer.
Well, Tom, I would suggest you take that up with your county administrator. I know that at the Hillsdale County Board, we've reported that the health department has been talking to the health department board about increasing that appropriation by the 15 cents. Okay. And that was what was told to our budget committee that request was probably going to be at. But that's something that I would bring up with your administrator as to why he brought it to your.
I
to
think
your
there
board
was,
commission.
there was some other appropriations that we need to act on. And I think everything was sent to the county, that this is what we were looking at for our budget. And it got put in with the other motions. I did try to bring it through the committee the other day, Tom. Was not for that. So we did table it till after this meeting. But the other appropriations that was asked for, we did approve.
Mr.
I don't
Chairman,
think there's anything secretly what's going on.
I'm not questioning the asking for appropriation. I am concerned about a board as a whole decided something, then it is going beyond that. That is my concern. I don't know who is wrong, who is correct. But the buck stops here, not the administrators of the counties. Thank you. Next one is I'll be discussing. Thank you, Mr. Chair.
Any other questions? All right, hearing none, moving on. Ms. Nichols,
Morning.
good morning. I'm sorry, I'm kind of sleeping this morning.
No worries.
Welcome back. No, I still have 3 more days, so.
I'll be pretty quick this morning. I don't have too many significant updates this morning. Becky had already mentioned, the updates that we have going on with the COVID vaccine. So that's been pretty consuming, moving to that commercialization process and trying to work with the vendors and things like that. It's a process. And then our EMR as well, just making sure everything is put into that system. So
But it is, we're approaching, respiratory virus season. So we do have our influenza vaccine in-house and slowly working on getting the new COVID vaccines. But we have seen some COVID cases and, but influenza activity is still pretty low at this time. Let's see here, COVID vaccine, although it's being commercialized, there will be options for people to be able to get that at no cost with, like Becky said, BFC or Bridge Access program. And then I think at this time, most private insurance, will cover that at no cost as well. There may be some insurance types that won't cover it fully though. Let's see here. I just wanted to give a reminder for our STI and HIV programs that we are part of the Wear One program. So, and that's a campaign that can provide free condoms. So anybody can come in and get free condoms. We can provide, education on STIs as well, testing and treatment. And then we do have a confidential HIV testing that can be offered curbside as well, which appointments can be made on our website. See here for WIC, I wanted to give a shout out to our breastfeeding peer that's in our Hillsdale office. She was chosen as peer of the year at the Southwest Region Breastfeeding Conference. So that was really, really exciting. I don't know how long Amy's been here, but she's a really, really great peer, very knowledgeable, very passionate about the work she does. So we're just really excited to see that for her. You may have heard some information about the potential government shutdown occurring on maybe September 30th or October 1st. There has been some different media about that in regards to the WIC program, that WIC could be totally shut down and that we would not be able to provide services. There was a meeting that was held yesterday that from the state WIC program, that information is false. We still will be able to continue WIC services if that occurs. It would be business as usual. They feel that Michigan is in a good place financially, that they can be able to, that it wouldn't influence the WIC program, which is great news. We don't want people to lose those benefits. I mean, it could be a different situation if that goes on for an extensive period of time, but right now they don't seem to have any worries or concerns about that happening. And then lastly, they did share that the eligibility for the Children's Special Healthcare Program is extending to age 26, which is huge. It's really great news to hear, because there's a lot of children that can be re-enrolled on that program, children and adults that can be re-enrolled on that program, and be able to get some of the services that they provide through that program, where maybe they wouldn't be able to have the funding to do that, not being on it. So I don't have a ton of details or information on it. I know that they had sent some fact pages out to some clients regarding that and how this process will work, but that is actually supposed to take effect October 1st. We looked at our re-enrollment numbers and we're thinking that could increase to maybe around 400 participants, which is quite a lot. So no information as far as budget right now, but they did mention that this could be a process as well and take around 6 months to update computer systems and things like that to make sure everything's flowing smoothly with that age increase. And I think that's all I have right now. So I'm happy to answer any questions. Thank you.
Thank you.
Thank you. All right. Paul, environmental health.
Good morning, everyone.
Good morning.
You probably all noticed that the reports were a little bit different this year, and that was, as I explained in my report, part of the month was still in our old system, the health space system, and then the second half of the month was in our hedgehog system. So I apologize, I was a little cumbersome this month, having a couple of different reports, but starting next month, we'll have everything in our hedgehog system, and we'll be able to just get one single report like we have in the past. So a little bit of inconvenience this month, but we're moving forward, and things with the new software program are going quick. We had, we still have a open position for a type 2 coordinator. We had interviewed and I had offered the position to a gentleman I thought was gonna be a really good fit. He was fresh out of Michigan State, had all the background we needed. Unfortunately, he declined our offer, and it was because we were paying up. And I bring that up just to kind of further piggyback on what Becky has said, and it's very difficult to find good people in environmental health. Last week I went to Environmental Health Directors Conference, and it's one of the things we talked about. All the directors are having an extremely hard time finding good people, and what puts us even further behind the 8 ball is that we're one of the lowest paid county health departments around. So it makes it very challenging, very disappointing. I thought that this gentleman would have been a really good fit. He's also a local person. He's been working here in the Coldwater office. He's lived locally. A person that really genuinely wants to protect the water resources of our counties. And he had a great attitude about it. I thought it'd be a really good fit, but unfortunately, that didn't happen. So we continue to try to find somebody to fill that position. The state started a free water testing program. Legislature appropriated $15 million for free testing for water. And that was overwhelmingly received by the public. It was for residential wells only, and within 10 days, that $15 million was spent. So we had kind of geared up to do a radio broadcast and promoting this, and before we could even get to the radio, the money was spent, and that's a good thing. I mean, it's a good thing that our citizens are really concerned about water, and took advantage of that. I'm glad that all those dollars were spent. People were getting their water tested. I'm hopeful in talking with folks at Eagle that promoted that program, that there may be some future appropriations to have that happen again. That would be really good. So they were offering testing for bacteria, for nitrates, and for a series of metals. So it was pretty comprehensive set of testing. There's no PFAS, there's so many things that obviously they could check for water, but these are some of the real core things that the people could get their water tested for free. These samples, like for the bacteria, the nitrates, they're $18 to $20. Metal tests are a little bit even more than. So, they're not extremely expensive, but there are some people that is expensive and don't have the money to test their water. And so a lot of people were able to take advantage of that. So the last thing I wanted to talk about today, a couple of House bills that have been proposed out there in regards to a statewide sanitary code. This subject has come up time and time again for a number of years. And one of the sticking points with the legislators is Michigan, the only state in the whole union that doesn't have statewide sanitary code. That's a true fact, but what people don't understand is each county has their own specific sanitary code. And those sanitary codes are reviewed every 3 years at accreditation. They set standards that are very high across the board for protecting our water supply. But there are these bills out there, and I'm not saying it's necessarily all a bad thing. One of the things that environmental health directors and Eagle and Mouth, the directors are the
Michigan Association of Local Public Health.
Yes,
Mouth.
all people associated. I'm a little trouble this morning. Anyway, one of the big things in these bills that's a real sticking point is there would be requiring an inspection of every sewage system in the state once every 5 years. So one of the things that was assumed by people that are pushing this legislation is that we have records on every sewage system across the state. We do not have that. We have tons of septic systems that were put in long ago. We have no records of things that were put in without permits. And so to try to compile list all those sewage systems and put them on a list, so you can have 20% the first year and then so on down the line. It's an impossible task to try to compile that list to begin with, and to expect that each individual health department is going to be able to pull that off. It's a huge, huge undertaking. And, you know, even though every state has their own, has a statewide septic code, none of them have this particular aspect in their codes. Nobody, because it's so cumbersome, so really unattainable. So that's one of the things that you know, the Association for MOLIHA, which is the Association with Environmental Health Directors, and MOUTH for health officers, and EGLE, everybody's really kind of trying to talk to the legislators. Say, you know, this is an impossible ask. So I don't know where this legislation is going. I want to get it out there to you and explain a little bit of the background on it. And with that, I think that's all I have today. I'd be happy to answer any questions anybody has.
I think county had Pat wrote Bushman's together.
Yes, I
County
talked to Bud Norman about that.
Yeah, did that.
Contact. Yeah, and I appreciated that.
And we just did that in our last meeting.
First meeting, but I think, you know, you said that you've got a position open in environmental health for that would work in that sanitary side, and you can't even fill that, and if you have to go out and inspect all of those facilities in 5 years, where do those people come from?
And because I meant to mention that, thank you for bringing that up, that it would create, have to hire so many more people, not just in our agency, but across the state. We can't fill the positions that we have now. We're having a really, really difficult time finding qualified people. And if we have to hire people to administer this program and do, you know, 20% of all the sewage system inspections every year, that's going to create a tremendous workload that we don't have the people currently to do that, and to try to find qualified people to fill those positions would be a really, really difficult task. Thank you for bringing that up.
Mr. Chairman, and also the Michigan Association of Counties, that association opposed the current set of proposals.
It's good to know. Thank you.
Any other questions for Paul?
Only that, with Michigan having county codes on an individual basis, does that mean that the county codes might be a little more accurate for the ones that they have reported? When you lay up against the state's codes that they're trying to propose, in general, they want to generalize the whole state, right?
Right,
So everybody would have to fit into that.
right.
Would that diminish some of the restrictions and regulations per county?
It could.
You know,
It
I mean, it would change all the counties.
It
right?
could, you know, in some areas it might be a little stricter, in some areas it might be less restrictive. You know, and each individual county has developed their own sanitary code based on their geological conditions.
Right.
And so
Right.
forth. So it's kind of tailored to that specific county. And like I said, these individual sanitary codes are reviewed every 3 years through accreditation. That's one of the things that they take a look at and make sure that we're covering and protecting our water resources. That's one of the main
Yeah,
goals.
so even though there are septic systems out there now that are not recorded because of date, even with the state coming in, that's not gonna come back and pick them up, is it?
I don't know how. I don't know how we're gonna
They have no
identify
funding on
those.
them. How would they identify them?
You know, we would identify them at the point where they fail. and they need to get something new put in. That's how we identify them now. That's the only way we can identify them now.
If they permit.
If they pull a permit, exactly.
Yeah.
Exactly. Yeah.
Any other questions for Paul? Paul, I will ask, I was not there, but I heard that there was a question asked at our commissioner meeting on Tuesday about Board of Health enforcement of a homeless encampment in Hillsdale. Campground there at the thrift store. Question asked about that. Are we?
So the issue and the order that I wrote on that is I had anything more than 5 site is considered an illegal campground. I went there Tuesday, they have 4 sites.
They have 4
We can do no more there. That's as far as we can enforce that. They have 4 campsites. They're, that was the only, they have bathrooms, they have water, they have everything that they need as far as that goes from an environmental health standpoint. The only thing that we could look forward on was the fact that they had more than 4 campsites, which they no longer have. So, as far as we're concerned, it's a close.
And right, and the enforcement on that was the Michigan campground
So,
code that
yes.
we are required to enforce. That says
Right.
5 or more campsites must be licensed as a campground.
correct.
Any other question? Hearing none. Sutter's not with us, so Rebecca's gonna give that report.
Yep, and of course, I can't do what Laura did in any respect, but certainly try to touch on things here. So, she does give you some victim of elder abuse program updates here. And, they did do a tour of temporary housing in Hillsdale County and, found that that was an exciting project. So the grant for FY 24 submitted, approved and signed, and looking forward to, a year of development and continued collaboration. For FY 23 year end, they're working to prepare the end and start of 24. Of course, this is when things get really busy. They reissue contracts for fiscal year 24. They report on 23, and they're just gearing up for a smooth transition from one year to the next. Outreach events, fair, Veterans Day, they were there, and the Project Connect event that's coming up October 6th in St. Joseph County. So for those St. Joseph County commissioners, if you want to stop by the fairgrounds that day, it's quite an event. I hope to be there myself. The Commission on Aging Board and Briggs County is considering enhancements to their congregate meals. So that's good, and more to come on that, she says. And the advisory committee that she has for her AAA is discussing and reviewing bylaws, and there's some draft changes coming. So that's what she talks about. There's also a letter included here that the things are operating as they should be, that they've done their assessment and we're in good shape. So that's always nice to have. And finally, Ashley said she apologizes. She has a sick kid today and isn't able to be here. But the things that she wanted to share, she did say she's on the live feed, by the way. She's watching us. Hi, Ashley. The ACLS Bureau is closely monitoring the federal budget. If continuing resolution, then 1/4 of state and federal funding will be issued. If a shutdown, 1/4 of state funding only at the prior year's appropriation. So there's the difference. And Cindy Masterson alluded that the state has mechanisms in place should the state or should the federal shutdown occur. So she did put a note here about continuing resolutions. Would you like me to read it? She just says, what is a continuing resolution? A CR generally continue the level of funding from the prior year's appropriations or the previously approved CR from the current year. Full year CRs provide appropriations for the remainder of the fiscal year and are functionally similar to final appropriations. A CR can include changes from the prior year's budget that could, 1, alter the rate at which funds are utilized, 2, extend an expiring program authority, or 3, provide a specific dollar amount of funding to a program during the CR. So it just makes things a little bit more difficult, obviously. Hoping that we don't go there, but we certainly could. Does anybody have any questions? I'd be happy to take notes and get back with you on
You didn't
anything.
mention that they presented to the state committee
Yes,
on the 15th
for the, yes, that just happened
fiscal year
for 24.
before, and that has been approved.
That was approved, yep. So every year we have a plan, and the plan has to be reapproved by the commission. And so, yes, Laura and one of her staff went up there and as well.
Any other questions?
That letter is in your packet, I see. So, yes.
Okay. Hearing none. Mr. Alex, health education.
Good morning, everyone. So health education promotional calls, August and September are event season, because we do a lot of events. Most notably the 3 county fairs, which have been mentioned several times. We did Branch County Fair at the beginning of August. The last 2 weeks we've done St. Joe. We're finishing at Hillsdale. After this, I'm headed out there. I will say that attendance seems to have been up at the fairs. Last year, the weather wasn't so great. The weather's been perfect for all this year. We've had a lot more community involvement than people actually coming up and talking to us. So it's been positive instead of some negative energy that has been around the last couple of years. So I think for the agency, that's a good sign. My department also was responsible in August for our employee well-being and appreciation event. We're able to do that through a grant from Valve. It's called the Well-Being Grant. It's basically towards the mental and physical well-being of your employees. This year we were able to go to a Battle Creek Battle Jack game, which is apparently a semi-pro baseball team. I did not know that. We started the process. I don't know a lot about baseball, but we encourage staff to bring their family and friends. It's a chance for everyone to get to know each other better outside of work. And as far as we know, the feedback we've gotten, it seems like a very successful youth fund. Everyone seemed to enjoy themselves, and got to watch a baseball game again. I couldn't tell you who won. I don't really know what baseball is.
Who's on first? Yeah.
Exactly. I don't know.
No, he's undecided.
Well, moving on to the 2023 medicinal marijuana operations and oversight grant. Project period for that grant ended on August 31st. This year we were able to utilize the highest percentage of those funds for all 3 counties that I've personally seen in the 3 years I've been doing it. We used 94% of the funds for Branch County, 85% for St. Joe, and 92% for Hillsdale. Feel very proud of my staff for coming up with new and unique ways to use those funds. One of the things that probably the most unique project and the final one we did, and I know I've mentioned before that we've done lock it up messaging and designs on beta buses. We're working very hard to try and figure out a way to do it with the St. Joseph County Transportation Authority. It's not something they've done before, so it's kind of new for everyone. We ended up being able to pull it off. So that's a few weeks ago. They have a design on one side of their bus, lock it up campaign. So if you're in St. Joe, look for that. It was, again, very difficult to figure all of that out, but now it gives them kind of a platform to continue on. It's not something they did before. We were kind of a trial run, so I think it went well. So that'll be on there for at least the length of the 1-year contract. Moving on to our community health worker, Rachel. She's continued to bring in new clients, but the last couple of months she's focused more on closing out some of her existing clients before bringing in new cases. She has reached a plateau of where it needs to be with the number of clients. So she was working on closing out cases before bringing in new one. She was also vital in water filter distribution during the St. Joseph County that instance, and she went to several of the distribution sites and helped out and answered questions, and she was very willing and helpful. We also recently submitted through the Michigan Health Endowment Fund a proposal for the Healthy Aging Initiative grant that would provide us with funding for the CHW program past the end of the current grant period, which would end in May of next year. We're expected to hear those results in the beginning of November, I believe. So we're hopeful that possibly get that. That's all I have. Any questions?
Any questions for Al? Okay. Hearing none. Feed forward. Financial reports. Payment for the month of August 2023 or before.
Yeah, so you have the payments before you, totaling $412,704.53. There's a couple of unusual things in here. On page 36, you'll see PHC Corporation of North America. That is the vaccine refrigerator that the board approved the purchase of. And then a little bit further down that column, you'll see Schindler Elevator. That's the half down payment of the elevator that was approved by the board. I would be happy to answer any other questions that you might have.
One would be for maintenance contract that's annual, and then the other is that door lock.
Thank you.
Any questions, or I will entertain a motion to approve the August payments as presented.
So,
Do we have support?
I second.
We have a motion to approve the August payments as presented from Commissioner Hoffmeister, support by Commissioner Matthew. Any further discussion? Hearing none, all those in favor say aye.
Aye.
All those opposed, motion carried.
Moving on, we have the balance sheet and the cash receipts and disbursements, then the expense by program, and you will see on page 41 that we're currently 16.97% under budget where we expect to be. A lot of that is COVID grants that went unspent. We do also have a number of other dollars that, as we wind down the end of the fiscal year, that have gone unspent. And that is largely due to staff turnover, where positions weren't filled right away. We think that we are in a good position. We believe we're going to add some money to our fund balance unless this board would like to direct some money to MERS for the surplus fund at the end of this year. I don't have an exact dollar amount. So if you would like to direct money again to MERS, I would request that you would make a motion similar to, approve up to $50,000 of unspent funds or up to $75,000 of unspent funds to be directed that direction. Otherwise, those unspent funds will go into the fund balance. But it is looking like we're going to have a little bit of extra this year.
Do we have a motion to approve the financial statement as presented?
So moved.
Motion by Commissioner Hoffmeister, support by Commissioner House to approve the August 31 balance sheet and financial statements as presented. Any other questions? I guess one question I've got is, you said pretty much unspent because of some COVID money that's not been spent. Will that have to be sent back?
The unspent COVID money and unspent grant funding has to be sent back. What would be unspent that, I would be referring to would be local appropriations that we spent, because we expected to have to spend those. And because we had such staff turnover, we did not spend as much as we anticipated spending.
So,
And we also had increased revenue from trip.
so are you reporting that unspent money that has to go back in the 403,000 on the balance sheet?
The 403,000 on the balance sheet is definitely unspent COVID money that has to go back.
Okay.
And that's money that they already sent us, because the COVID funds are a little bit, they operate a little bit differently than our other grants. They sent them to us 1/12 of the grant amount, whether we spend it or not, where the other grants only send us what we have spent. And so that money is sitting there. We've been overpaid, and we have to send that back. That is not like the other grants where they didn't pay us in advance.
How much from the local appropriations do we have?
It's really hard to tell right now. We have a lot of big ticket items that haven't hit the financials. You know, the financials lag 30 days behind everything else. And with payroll, even, you know, it is very hard to indicate exactly where we are because we don't have it closed up yet. We do think at this point we're going to be able to repopulate some of the capital improvement funds that were totally spent out. With the current dollars, we only have about $9,000 left in our capital improvement funds. And we think we're going to be able to replenish some of them with unspent local dollars to get us back to a place where if we have something happen, we can do that. And I'm unclear if there's going to be other money that would be available. It's just too hard to tell right now.
So just in kind of the conversation, not to hatch it right now, but with the local appropriations, it's a catch-22 because, you know, the health department's asking for an increase in local appropriations, yet we have excess appropriations due to justified reasons, employee turnover. But it is kind of hard to go back to the boards and say, hey, we need an increase in local appropriations, and yet we have surplus of local appropriations. Again, it's justified, and I understand why we have that. But you know, and maybe if we increase them at the county, our own individual county level, maybe we wouldn't have that turnover because employees would stick around and not look for greener pastures. But it's just kind of a catch-22. I wonder if rather than taking that money and going towards MERS, if we did like a one-time bonus for employees or something in that regard, just thinking out loud, something that we can maybe think about. Because we do want to keep good employees and we want to be competitive in the market, but how do you do that? So again, I'm sorry, not to hatch it up right now.
Motion on the floor to approve the
Sorry.
financial statement. Any further discussion regarding the financial statement?
I have one question.
Yeah.
To Ms. Fisher, she has indicated that we have COVID money left over, and chairman also mentioned we will have to return. I wonder if the finance committee had an opportunity, she had some recommendations where we can spend some money, COVID related areas. Thank you.
So at this point, we don't have any recommendations on how to spend those COVID dollars. We have recently had a meeting with the state partners. Some of these COVID funds were delivered to us with one set of rules, but then when that money was actually appropriated by the legislature, it did not include the rule set that we had anticipated, and it can't be spent the way we anticipated spending it. And therefore, every time we have asked them, can we do this, can we do this, we get a lot of no's, and they're struggling with that all across the state. So they're rolling that money over next year, and it will have a little bit different rules than it has this year, which should allow us to spend that more appropriately. And one of those buckets is the supervisor training that Rebecca's asking for, and that's a use of spending COVID dollars. Another big part of that is we get a lot of money right now for COVID immunizations, and the fact is plain and simple that people aren't coming here to get COVID immunizations. So that money is going unspent, and the only thing I can spend it on is to give COVID shots. So,
Yes.
One more. I like that idea of the training. I'm sure the commissioners will consider. I wonder where it is going to be held at the Mackinac Island.
Ah. I'm sorry to laugh. No, it's not at Mackinac Island.
We'll get into that when we get to that, I guess. Any further discussion on the motion to approve the financials? Hearing none, all those in favor say aye. Aye. All those opposed, motion carried. Right, moving forward, finance committee report. Minutes. Commissioner Hoffmaster.
I was absent, unfortunately, so I'll have my right-hand man, the esteemed John Houts, take over this one.
Yeah. Myself and Steve are here, we did go over, the idea of having training, we did put that through to go to you guys. For indispensable supervisor training, and then the other was the vaccine method policy. That's, I believe it's in the packet. But other than that, that was also moved to the full board, so all I had to report on until we make those motions, I guess.
Okay, do we have a motion to approve the finance committee minutes?
So
Support.
Motion by Commissioner Huffmaster, support by Commissioner Lanius to approve the September 18th finance committee meeting minutes. Any further discussion or corrections?
It did take 7 minutes to go over those. Very lengthy meeting, so it was very productive.
I think we almost went 12 minutes till.
Yeah.
Not
Great
according
job,
to
guys.
that. Yeah.
If I could too, I just want to, in what we provided for you with what was approved by the state, I had indicated 12 individuals. I later recalculated and recognized that I missed a supervisor, and I wanted to also provide the opportunity to our EPC coordinator. I did get secondary approval when you guys had asked about this at the meeting. I did get secondary approval on that, adding those two individuals. So that's approved.
Motion to approve the minutes as presented. Any further discussion? Hearing none, all those in favor say aye. Aye. All those opposed, no. Motion carried.
Meeting shorter. So.
The Program Policy and Appeals Committee did not meet.
Oh, that's right.
We won.
All right, new business, the indispensable supervisor training, that's on, starts on page 44. And that was discussed at the finance committee meeting. And the finance committee recommended that we proceed with this, so I will entertain a motion to approve.
We'll approve.
I have Commissioner Lanius first. Motion by Commissioner Lanius, support by Commissioner House to approve the indispensable supervisor training. Any discussion on that? Hearing none, all those in favor say aye. Aye. All those opposed, motion carried. Vaccine pricing method policy is before us now. Also discussed by the finance committee. Do we have a motion to approve?
I'm gonna move to approve this price.
I will support that.
Thanks.
We have a motion by Commissioner House, support by Commissioner Lanius to approve the vaccine pricing method. Any discussion? Commissioner Matthew.
Thank you, Mr. Chairman. I know it is a perennial issue every year since 2019. We think brought this before us. This time it is 30% of Indian shop or it's a collective. Number two, 30%, we have a lot of seniors live in Branch County. I do not know other counties. And for example, from our Director Nichols report page 11. For shingles, many of seniors like me get the shots. It is over $200 or $300. So if we are going to put 30% of that a single shot, that's a considerable amount. I understand that insurance and various other companies provide that. I wonder, Mr. Chairman, that page 11, Ms. Nichols' report, if she can help me out with 21-22 fiscal year and the current, this is approximately 6 months. Are we down or? My concern is that, as I mentioned last year, we increase prices, people may not come. We are here to serve. Science is our mission, helping people live healthier. Our vision to be the trusted health resource for all people. So that is my concern. Thank you.
I was gonna have Kelly answer the 30% question.
Yes, so it is calculated by the cost per dose plus 30% per vaccine plus a $23 administration fee for vaccine. So that 30% is for price fluctuations, since we are only doing the fee schedule once per year unless a significant change happens to occur in the cost of it. And then also we're not charging a copay. And then the administrative is to cover vaccine supplies like Band-Aids, needles, and to supplement staff time. I'm not certain of your question on page 11 as far as shingles.
Mr. Chairman, thank you. My question in that regard is, for example, as a senior citizen like me, come over here and get a single shot and $23 administrative fees. I do not know the exact price this year, just say $300. So 30% we are going to assess. That is how much?
$90.
$90.
No.
It's built, right?
No, the 30%, so if we pay $10 a dose for that vaccine, we're gonna add 30% onto that. So the charge that we're going to bill for that vaccine is $13, plus the $23 administrative fee. Okay, the 30% is not 30%. Okay, that administrative fee is the administrative fee, and if you have health insurance, many times we're going to bill out that health insurance carrier. All right. Some of those health insurance carriers doesn't matter what we bill, they're going to pay what they call as their set fee for that dose.
Thank you for that.
Mr. Chairman, what is the price of the vaccine? Do you have that number or approximate?
I can look it up for you.
It is expensive.
If
So I think he's on the right track. And if he's saying the dose costs him $300, then you do add 30% of that, which is $90. So that's $390 plus the 23. That's where you're going, right?
Yes. So thank you for clarifying.
I mean, if you're at a $10 vaccine, that don't seem like a big deal. And I understand the law of averages here, but I see where he's going.
If I might interject, this is not a change to our fee schedule. It is exactly what you approved before. It is only a change in, instead of bringing you the fee schedule every single time we add a vaccine, we're bringing you a policy so we can add vaccines when they come on the market. This is exactly the same rationale that we have used for a very long time. It's not a change in price. It's a change in
format.
Yeah.
You're just making it so that when a new vaccine comes along, you can enter that into this equation.
Right. So rather than give you a fee schedule every time something changes, we're asking for you to approve a policy that feeds that fee schedule.
And if they have a new vaccine October 10th, we're not meeting again until November, they wouldn't have a fee that they could put on that until the November meeting without this policy in place.
Right.
As I mentioned earlier, flexibility. And-
Mr. Chairman,
Yes.
the Food and Drug Administration is not going to approve some medication from 10 days or 30 days. So I guarantee that. Secondly, Mr. Chairman, my question to Ms. Nichols was, I wonder if she can explain to us at page 11 of the report, the charts in 22 to 23 is up from 21 to 22.
Page 11 of that,
Page 11 of 59,
oh, page 11,
Cases.
that's page,
personal health and disease prevention.
Page
Those are-
12 has the number.
the page 12 has the immunizations on it.
Okay, thank you.
Sorry, I need to, I need to find that. I was looking up the pricing for Shingrix. So right now we have it priced as the cost per dose is $183.22. So adding the fees to it, the total cost would be $262. But I do believe that Shingrix is also on the My AVP program for adults.
Which means if an older adult is uninsured or they have insurance that doesn't cover Shingrix, we are able to give that vaccine to them at no cost. And so that's your safety net.
And there are 1, 2, 3 shots, you know?
Shingrix is 2 doses.
But that's total for both doses.
No,
No,
That's
per
each dose.
dose. Yep, per dose.
It's very expensive.
It is. That's one of the most expensive vaccines.
Don't wanna get it.
Each alternative.
My concern is I'm not saying for my son. We have a lot of seniors being, we are in a lake, beautiful lake region. We have a lot of people retired or working and come and live here. We want to support them. That is only I'm not questioning what you are proposing.
Mhm.
I support when necessary, but we need to think of.
Let me reiterate this, this is not a price change. This is a policy change, so they can add in new shots when they come available. To use this equation to calculate the base prices for that, so just. And backing up one statement, maybe there are shots in the works right now that will come to fruition within the next 10 days. They've been in the works for years, but, okay.
I thought the same thing. For that one.
I couldn't leave it.
most of our seniors are covered with Medicare, and Medicare is gonna take care of getting these types of vaccines. So I think probably we should be far more concerned about adults that are not Medicare eligible.
Until you hit it, what age, 55,
It's 60, isn't it?
55 or 60, Shingrix won't be covered by standard insurance.
So. Those are the
Well, then you're
things.
underinsured, it's covered anyway.
Maybe.
Lots of stuff.
Well, if you're eligible, Shingrix, you can get it at age 50.
50.
Can't remember.
Ooh, she knows.
That's because I'm 50. I'm over 50, but not yet 55. Pretty sure it's 50.
We'll go with your 50.
I'll fit.
Oh, well, you wanna know if we're down? Looks
Are
like
we up or down considering from last year to this year?
on vaccines, well, Tom, I think the numbers speak for themselves on adult immunization there, we're down. On child immunization, it looks like, for the month of August, year to date, on page 12.
We're up.
Well,
Yeah.
we should be up by the end of the fiscal year, but because that number for the prior fiscal year is for the entire fiscal year, right?
Mhm.
Okay, and, all VFC doses given were 19,838, and last year we were 20,037.
Do we include COVID in this number, Kelly?
I'm sorry, what was that?
Is the COVID vaccine included in this number?
It is.
Yeah,
So
so, yeah,
year to date on the adult immunizations, 2,062, and last year we were 7,305.
which is because of the COVID vaccine. So, people stopped getting the COVID vaccine. So, we're done.
We have motion and second, a motion on the floor. Any further discussion on the vaccine pricing policy? Hearing none, all those in favor say aye.
Aye.
All those opposed, no. Motion carried. Letter C, local appropriation.
I've already said quite a bit. I mentioned that Teresa included additional information for you today, so I'd like to ask her to go over that.
Yeah, so it came to my attention that the Branch County Treasurer called me this week and indicated that he had been getting questions from Branch County board members on our agency's finances. And I am a bit concerned because the Branch County Treasurer is not, he doesn't have enough detail to adequately express what our financial situation is here. And because he's in a position of power as a treasurer, people perceive that he knows what he is talking about, when in reality, the information that I shared was not accurate based on what he shared with me. And the information that I know was discussed, because he indicated to me, was that we have a very large fund balance, which is accurate. Okay, so part of the statements were accurate, but part of them were a bit misleading. So I have put together a one-page thing for you at your place that addresses this. And the designated fund balance that we have is the largest part of our fund balance, and it has $2.7 million in it. And the breakout of what those funds are and what programs earned those funds are given there. And if you look at that, the BCCF funds, those can only be used to serve the healthcare needs of the low-income or medically underserved residents, Branch Hills, and Sage. That's a grant from the Community Foundation. That money's sitting out there until we can come up with a reason or something to write that grant for to get that money spent with the Community Foundation. The dental revenue that we have sitting out there is only able to be used for public health, dental outreach, and education services as part of our contract with MCDC. And the reason there's so much sitting there is because during the pandemic, we weren't seeing clients. We weren't doing a lot of outreach. The dental center was closed, so you don't want to outreach a dental center, it's closed. I mean, there's a lot of money sitting there, but it can only be used for that one specific purpose. Then you get down to cost-based reimbursement dollars, and that's the largest portion here. And that can only be used to support the programs in which it was earned. So then I list the 3 programs. There's 3 programs that money can be spent in: immunizations, hearing, and vision. That's the only ones I can spend that money in. Then the community stabilization dollars, there is, those could be used to support ELPHS programs, but the funding can't be used to supplant funding. It can only be used to support new initiatives. So new things that you weren't doing before you started getting this grant. And then the RU 852 collector fee revenue, that's actually going to be moved into general fund because that program is gone. And then the capital improvement accounts, that can only be used for capital improvements. So when you look at that, that's 13 programs that we can use that $2.7 million in. That still leaves us, if you look at your financials and your RUs, I mean, we have 56 different RUs that we track here, right? And about 26 of those more above this 13 are actual programs that I have staff working in that will be fluctuating. So I have, yes, I can use that money in these 13 programs, but I have 26 other programs that I can't use that money in. Then you have to look at, in April of 2016, the board passed a resolution that set the fund balance floor to the amount of 2 months of operating expenses. The resolution that they passed is on the back of that sheet of paper. And it's not clear, it's not made clear what that is. Is the resolution referring to total fund balance, or is the resolution referring to spendable fund balance that you can use for anything? Okay, because depending on how you interpret that, that puts us in a very different spot. I logically concluded that the board's intent was that the agency could operate for 2 months if it became necessary on their fund balance. And interpreting that way, we would have to have 2 months of unrestricted or undesignated money. And we are not at that point in our fund
Say,
balance.
I would take that entirely different. I take that as 2 months of your fund balance. Okay, 2 months of spending. So if you have a $6 million budget, you need 2 months of that in fund balance, because the fund balance, yes, it's restricted or reserved, but it's a money cash flow situation where, yes, this month we may use that cash that was in that restricted fund, but when we get the money back in, it's still in that restricted fund. So I would take that as the way that resolution reads, that it's take your annual budget, divide by 12 times 2, that gives you your fund balance reserve requirement.
And it can be interpreted that way. It's not clear to me. So that is where we are. The statements that were made by Branch County that I find distressing, the Branch County Treasurer specifically, was that he indicated that we have $116,000 of excessive interest from our class account, money that we have set aside in a class account that earns more interest, and that is the interest on the grant fund is not designated or is not restricted to that use. And that is accurate. But what's inaccurate in this statement is we apply that interest to our financials every month when we get the report from the county. They're going directly in and they're supplementing our budget. They're not sitting out there as unrestricted. That money that is, the part that he doesn't know and can't speak about is our financials, what we have designated and what we don't. So yes, that money is sitting in the class account because it hadn't been moved over, and that seems to be a miscommunication between us and Branch County. But what is inaccurate is that money has already been spent. The money that is sitting, we get from Branch County a dollar figure. This is what we have of your money, and this is how much we get in interest. We don't get a report from Branch County that says, this is how much is in the class account. This is how much is in your cash account. We see the total dollar, we balance to the total dollar. We keep track of what is in our restricted fund balance, our designated fund balance, and our operating fund balance in our own books, and they don't know that, right? They don't get that from us. So he has indicated that he told Branch County commissioners that there's $116,000 of unrestricted funds out there. That does not exist because we pull them in every month when we get the interest from Branch County. We incorporate that, we book it into RU10 and spend it, which is one of the reasons we have unspent local appropriations, because we spend interest and book interest before we book appropriations. Okay. And the class account interest has gone crazy this year. Okay, so from the years years 18 through 21, the net activity was $35,000 for that period of time of interest. For the year 2022, we got almost $27,000 worth of interest off of that. This year, so far, we've already received $53,000 worth of interest. Now, how do you predict what the interest is going to be on an account like that? It's very difficult to predict and budget for. So, we've already doubled what we got all of last year. So we didn't guess correctly when we put our budget together on what our interest was going to be, but we always book interest first before we book local appropriations. So that money is really not sitting there as undesignated. What has happened is they have applied cash that's in the cash account that is part of the designated fund because they don't have the detail. It doesn't matter to them. They have this much money. We keep track of the detail here. We are the ones that know what is designated, what is restricted, and what is operational fund balance. So, that is, it's very distressing to me. So I will say, we do have a lot of money sitting out there in fund balance, but it's very restricted, as you can see, on what we can use it for. And we are making appropriate changes. The COVID years really they were very hard years, but they were very good years for them, right? We took in a lot of money that supplemented our budget in ways that we've never seen before. And now we're coming down off of that high, and we did manage to put a lot of money in fund balance that has these restrictions on it because we didn't have to spend it. The problem that we have moving forward is that we can't always count on all these revenue sources, right? The COVID money is going to go away. This interest money that's blown up, which is great. I mean, I love having it, but I can't count on the interest being double or triple what it was because I just can't count it. It's like betting on the stock market. It's something that I just can't incorporate all the way into my budget. I love seeing it, and when I have it, it's great. But when I look at, do I want to give my staff a raise? Can I count on that? Because then if that raise doesn't come through, then I have to hit fund balance. You know, if that interest doesn't come through, I have to hit fund balance. And budgeting here is different than a lot of places because we have 50 different RDOs. And I can't spend this money for that. I can't spend that money for that. And we have 75 people, and I have to say, oh, you're working 2% in this grant, 4% in that grant, 5% in that grant, which makes it very, very complicated to make it all work out in the end. And I am not saying that we're going to perish and die and close the doors if we don't get the 15 cents. What I am saying is that it is our job to do the best we can for this health department. And when we put original budgets together, it is very, very hard to make them balance because we don't have the full picture. And we still didn't have the full picture. You know, we put those original budgets together in June, and when we put those budgets together in June, we couldn't afford to give our staff a raise at all. Not any cost of living, not nothing. Now, it's a better picture now than it was then, but we still don't have all the information. We know we're getting this information on this increased ELPHS, but we don't know how much. We know that health insurance is going to go up, and we're projecting 12 to 15%, but we don't know because we don't have the number yet. And we know that MERS went up $30,000 this year. And, you know, there are a lot of things that we know, but there are still things that we don't. And it becomes a question of, even with staffing, when you run a budget that's very, very tight, one person that leaves can make a big difference. And it can make a big difference in a number of different ways. So one, maybe it takes us a while to hire that person. And if it's a nurse, that's a big salary that isn't getting spent. But also that person that left might have been a single insurance coverage person, and the person that comes in might be a family coverage person. And you're talking about $10, $15, $20,000 every time you get a change like that. If they're cash in lieu, if they're family coverage, that's, I think, $17,000 difference. So just one person can make a $17,000 change to your budget, just like that. And when you have high turnover, it makes it very hard to budget if the budget is very narrow. So.
That being said, thank you for all you do.
Yes, indeed.
One of the question I've got on these fund balances is, I went and I pulled the audit from a year ago. And the first two that you mentioned there haven't changed since September 30, 2022. Medicaid cost reimbursement went up $160,000. And the capital improvement, obviously, will be expensive money that went down. So I guess I'm concerned that, you know, we've got these funds there, and, you know, we just reopened the Hillsdale MCDC clinic, coming up on a year ago now. And I would have thought that, why aren't we spending those funds? There's, that clinic's been closed for over a year. It's reopened. All kinds of opportunity as far as I'm concerned to spend those funds.
No, you are correct, and 50,000 of that is encumbered for the incentive of that gentleman. But part of the trouble is staffing. What kind of outreach you do, and I wouldn't say that we have a great plan on dental outreach right now. But some of the other things that we are doing is we have Brene is with us as our company. She's just now been with us long enough to really understand and grasp how things work and what happens. And we are making some changes to how we do some things to help us spend some of this money. Last year, we added an RU for dental so that we could track and spend some of that money. Now, the staff haven't put a lot of time in there, so that is part of the issue with that. But we added that last year to try and spend some of that dental money. This year, the way they have tracked immunizations is one of those, it's always been done this way, but it made no sense to anybody that were doing it. So this year, starting 10/1, we are totally changing the way we're tracking immunizations. And that should help spend some of this cost-based reimbursement dollars. Because previously we had two different RUs and there was an allocation going between one and the other. And now all of that activity has moved into the RU that can be cost-based reimbursable. And the only thing that's sitting in the second RU is what it was actually named as, which is vaccine storage and handling. So they were doing some stuff, and I don't know why they ever did it the way they did it, but we've corrected that, which should help spend down some of those dollars as well.
I know that Teresa and Brene have put dental funds, for example, into the budget every year with an intention to spend them, and then have had to back them out to utilize other funds. So that's.
Well, and that is the same with community stabilization dollars. I was just talking with Brene this morning, and we have one position that we fund with community stabilization dollars. And because of staff shortages and turnover, the grant would not have been spent if we left that funding as community stabilization for that position. So we've charged the grant for that position and now haven't spent that position funding for community stabilization, because the community stabilization dollars I can spend in any grant that's ELPHS, where that grant would never have been spent and I would have sent that money back where this money was. So we do make those type of decisions all the time.
Teresa, do you have it broke down? I didn't see it. I just did some quick math. So St. Joseph County would be about a $9,000 increase.
Yeah, it is on page
52.
Yeah, 57. So the proposed increase for St. Joe would be $9,121.
Thank you. Yep. And what did we do last year?
15.
So we did 15 last year, 50 back up.
Which.
Yeah.
Thank you. Thank you, Ms. Fisher. Thank you for your work. We appreciate the 5 items you have given to us. Designated fund balance. Is it anything under unrestricted funds? Please.
How much is unrestricted?
Yeah.
So anything that's designated is designated and can only be used in those programs. So if you look kind of to the bottom of that page, the operational fund balance that has no restriction on it right now is $601,084.80.
But some of that, when we do that audit, is going to be designated towards unpaid vacation and sick time, correct?
That's the restricted. You see that in the restricted.
Mr. Chairman, thank you. Yeah, my second question is, like our health officer indicated earlier, we have our brightest and hardworking employees. They need to, if the commissioners decides appropriate, this unrestricted funds, I thought it was 1.6 million. You have given us 600,000. Either way, Mr. Chairman, we can use that unrestricted funds for our employees. Number two is I think we are getting $5.30 per citizens in each of our counties, 3 counties. So if we increase another 15 cents, that will be $5.45 per person. I wonder if it is children born to just born.
By the census.
No, it goes off of the last decennial census.
And so I can only speak at the moment to our branch county. We have several $1 million in the first budget analysis. We are already short, and we want to add more deputies. That is almost $1 million a year or more or less. Now, under those circumstances, Branch County, I believe about almost $7,000 to pay. I cannot, in good judgment, I cannot support at this time. But again, I urge, I went to get bread 35% at Aldi's, and the price already went hot. So our employees are suffering, and they have to pay gas coming from their home to work here and going back. So I think we need to encourage them by providing from any funds from the unrestricted funds. That is my request. Thank you so much.
I support the 15-cent increase, as our mission stated, helping people live healthier, vision, be trusted, health and resource for all people. And $6,000, understand Branch County is $3.4 million over budget going into the cycle, but $6,000. I have a big picture of 3.4 million. It's better to go towards our staff to give better resources to citizens that need our service. I have no issue with the 15 cents.
Remind me again last time, did we take this to the full board or to our increase? Obviously, right?
It'll still have to go back in.
Yeah, that's what I thought. So we're just essentially recommend, we either vote to recommend or not today.
All right, and in our packet today, and Teresa in the past, Rebecca has always done a comparison based on cost per capita, comparing that with some other health departments. I said, I don't know if that's the best way to do that. So working with Teresa, we put some additional numbers together for you, and those are in your packets. And that's on page 54, that gives you a breakdown. But the department, other health departments that are listed also looked at taxable value for real and personal property in each of those counties or in the combined counties, or those health agencies serve, and then taking the general fund county allocated operating millage those counties levied in 2022 to come up with the combined general fund property tax revenue in each of those counties. And then as far as the local appropriation, what percent of that general fund property tax revenue does that local appropriation to the health department make of the that general fund property tax revenue. To me, that's a better comparison than just looking at a per capita, dollar contribution, because you take, Kent County that's got a $28 billion, taxable value, and they put in $14.40 per person, but, Lenawee County, which I live 4 miles from, they only put in $300,000. Which I don't know. And I didn't notice this until this morning, or we don't have Jackson County on this list.
I'm not sure why we don't have Jackson, but single county health departments, that could be slightly misleading because the counties probably do some support. So their HR, we do our own HR, their
Shared services.
their IT, their, so that may, if you look at that, look at it through that lens. Single county health department has a little bit different structure than a district health department though.
When Calhoun's not on here either, right?
No, the comparison was I put out a general call to all of the finance administrators at all of the public health departments, and these are the ones that answered me, basically. So those were the ones I had data from, as far as what their local appropriation was and what their per capita funding would be.
And according to this table, we are third from the last as far as property tax percentage of revenue allocated to health.
Fourth, there's a 2.9 that's elementary.
Oh, you're right.
It's okay.
So we're fourth. So yeah, I agree with Commissioner House. I'm fine with the increase to the, I mean, if you look at it, like on page 57, it's a 2.83% increase. We are, if you look at the table that Commissioner Leonard, had staff put together, I think it does justify that we are low as a percentage. I hope that we can stop with turnover and maybe spend some of those. I understand a tight budget.
So, do we have a motion to approve the 15-cent increase in local appropriation?
So I'll support Commissioner.
Thank you. Is near the roll call.
Is there any other discussion regarding that? Oh, Commissioner Matthew said, I serve on as the budget chair in Hillsdale County, and you look at those without a county administrator, we as the budget committee look at those appropriation requests from each department, and yeah, looking at that budget the first time, way more requested funds than we have. As a government, we don't get to change the fee that we charge just because inflation is driving our cost up. The only time we see an increase in revenue is through inflation or sales. We have an increase in property tax values, which each of our counties saw this last year and is going to see again next year. And or if the voters approve a change in millage rate or an increase in millage rates. So it's the only way we see for the most part, see an increase in revenue. So any further discussion?
Only, Mr. Chairman, only thing I want to share with my fellow commissioners here is if we approve, we will be facing, you will be making a decision in New York board, just be aware.
So, and as I read the general operating agreement between the 3 counties, any local appropriation request from the health agency must be adopted by all 3 counties to be final. So And it has been requested, and I was going to do this anyways, but we will do a roll call vote on that.
Commissioner Matthew,
Absolutely no.
Commissioner Houts, Commissioner Hoffmaster,
Yes.
Commissioner Leininger,
Yes.
Commissioner Baker,
Yeah, we'll let the board decide.
Commissioner Lanius.
Motion will pass 4-2. That brings us to letter D, health officer evaluation. And our health officer has requested that we go to closed session for this, so
I move to go to full person
for the purpose of.
for the purpose of, evaluating the health.
Motion by Commissioner Baker, second by Commissioner Matthew to go to closed session for the health officer evaluation at the health officer's request. We will. All those in.
Do we need a roll call for closed session?
Why don't we?
Yes. Yes, you are correct. Thank you.
Commissioner Matthew,
Yes.
Commissioner Houts, Commissioner Hoffmaster,
Yes.
Commissioner Leininger,
Yes.
Commissioner Baker,
Yes.
Commissioner Lanius.
Yes.
Thank you.
Motion will pass 6-0. We will start that closed session at, 11 o'clock? Give it 1 minute.
Then board green dots.
So that would be a 5-0 with one absent on that vote, so.
Do they have to be a roll call?
No, it doesn't have to be roll call, but there's one absent. Now, I will entertain a motion to accept the health officer's evaluation. I do believe that evaluation score is, be a good evaluation, good to excellent evaluation.
Good to excellent. I'll support that motion. You making a motion?
I'm looking for that motion.
Making a motion that we accept their evaluation as a good to excellent recommendation
Second.
for evaluation.
Motion by Commissioner House, second by Commissioner Baker to accept the health officer's evaluation as good to excellent. Any discussion? Hearing none, all those in favor say aye.
Aye.
All those opposed, motion carries. Next up on our agenda is the health officer's merit pay for the contract that we have reviewed. The health officer shall be awarded merit pay of up to $5,000 upon a satisfactory evaluation of the Board of Health. So if she has better than a satisfactory evaluation,
We'll give her $5,000 merit pay.
Second.
motion by Commissioner House, second by Commissioner Baker to award the health officer her $5,000 merit pay for her contract. Any discussion?
Yes, Mr. Chairman,
Commissioner Mann?
I think it is very valid and very important. Score she has received and all the moreover service she's rendering to all three counties. Number two is, Mr. Chairman, my question is that $5,000, our commissioners decided a few years ago, correct? So that 5,000 today's value is probably more than.
I don't think you're doing the math quite right on that, Mr. Matthew.
I tried to get a few dollars for my, our health office, and I guess I'm not going anywhere.
Any additional discussion on the merit pay award for the health officer? Hearing none, I will ask that we do a roll call on this.
Commissioner Matthew,
Absolutely, yes.
Commissioner House,
Yes.
Commissioner Leininger,
Yes,
Commissioner Baker,
Yep.
Commissioner Lanius.
Yes.
Thank you.
motion passed 5-0 with one vote. We have at this time no additional new business. As Teresa did indicate that we may have some excess local appropriation funds left available. Do we want to take any action on those, add those to the general fund balance, or contribute those to the excess reserve in the pension program?
They're talking about the pension fund.
The pension fund, right?
And there were two figures you gave us earlier, right?
Yeah, we don't really know what the dollar amount's gonna be.
So
Up to 50,000 or up to 75,000, I think would certainly cover more than what we are.
When will we know that dollar?
Close to the end of October.
We'll know it by our November Board of Health meeting.
Yes.
Table it until then to get a new.
No, we can't, because we need to make that.
It needs to be part of the year-end close.
Right, it has to be part of the year end close, which means I have to do it before the end of the fiscal year, which is, basically.
Mr. Chairman, could you correct me, please? Is that 75,000 plus? Is it a restricted or unrestricted?
Those are unrestricted funds, which gives us that flexibility of being able to contribute those funds to the pension plan. Remember, our basic obligation increased $30,000 in the next fiscal year that we have to contribute to that pension plan. With that reserve, we are looking fairly healthy on our pension as far as that, funding percentage, but we're going to start seeing, we already seen some of those people who are in that fund leave employment here, and those numbers are fast dwindling.
Well, the bottom line is the reason we have it is because we've had staff vacancies and we've saved money, so I moved that we up to 75,000.
So I would support that.
So we had a motion on by Commissioner House, second by Commissioner Lanius to contribute up to $75,000 of unused local appropriations toward the pension access fund. Mr. Matthew.
Thank you for the discussion's sake and for what you have talked. However, I wonder if as a bearing on giving the employees an increase, just say 1 to 20%, whatever the administrator will come up with, what it cost us. And you say 1% it is, 2% it is, 3% or 3.5 or so if we put this money, unrestricted money, put 75 elsewhere, unknown money, then where are we going to look for money to give it to our hardworking employees?
This money just gets sucked up into taxes.
You know, part of the thing that we've got to look at, Commissioner, we not only have to look short term, but we have to look long term. And that long term pension obligation is something that if we don't pay for it now, will hamper our ability to attract and retain employees long term, especially down the road when we start having to contribute $700,000-800,000 annually to that pension fund. You know, so by building that reserve up now while we can, gives us that flexibility to spend those dollars down and use those reserve dollars in the future to pay down that increased pension obligation that we're going to have to make. I still think that, you know, if you look at the budget, you look at the other fund balance figures, you know, some of those employees, should we decide to give a pay raise or to offset some of that increase that we may see in health insurance and some of those other expenses, some of those restricted funds that we have, some of their pay comes out of those other restricted funds already. So if we increase the, if we have a pay raise, those people who are working in the Medicaid cost reimbursement area, we may not see as much of an increase in that fund balance there because we're using some of those funds to pay for the dental and vision and the immunization stuff that Medicaid cost reimbursement pays for anyways.
And remember, this next year's budget is really unknown. We don't know what we're getting for
Right,
the
and,
BHI.
you know, and MDHHS, I mean, that budget saw what, a $30 million increase
25.
at the state level.
Right.
I agree, Mr. Chairman, your points are very valid. However, I personally believe we address the increase if and when the commissioner decides to provide, then see how much money left. Like you have indicated, it is unknown. So we do not know how much. So why don't we address the employee's situation? And then whatever left over, legally we have to provide, I understand that. So that's my thinking.
And I would say for part of the issue is because we have to do this in our fiscal year for our fiscal accounting. And our fiscal year ends Saturday.
That's correct. I'm just thinking it's gonna be a hard sell to go back to my county and tell them we want a 15-cent increase per capita when we're talking all of it, at least, back into a MERS program and not back into.
So you're jumping on excess from this year. The reason we have excess this year is because we had staff turnover and we didn't use a lot.
I understand that, but I'm just, when I go back to my county and tell them that.
You choose what you tell.
I'd be happy to come talk to you.
We can give them a presentation.
I can tell you ahead, nothing private about it. I wouldn't be voting for that increase, $5.35 per person individual to our station. I don't know the rest of the four commissioners in our board, except I know Mr. House is for. For him, 15 cents means nothing. I came to this country with $8. Still,
Still got $3.
That's a good deal.
We have a motion on the floor. Any further discussion? Hearing none. We'll take a roll call vote on contributing up to $75,000 of unused local appropriations to the pension reserve fund. Teresa, if you would do the roll call, please.
Commissioner Matthew,
no,
Commissioner Houts,
Yes.
Commissioner Leininger,
Yes.
Commissioner Baker,
No,
Commissioner Lanius.
Yes.
Motion will pass 3-2 with one absent. Any other business? Hearing none. Public comment? None. Before we adjourn, just a couple of points to point out and to request. We did not meet in October. With the holidays coming up, we will have committee meetings in October, but our Board of Health meeting will be November 9th. And then our next Board of Health meeting will be early December, mid-December.
It's December.
Yeah, so just a reminder on that.
Now I'm done. You got to put that whisper in there.
One other comment that I would ask is, I think we've asked this last month and we don't have it yet. That report from Municipal Consulting Services that was done in 2019.
Can send that to you.
Can you share that with all the current Board of Health members?
Yes, I'm sorry.
Because I think only maybe Commissioner Matthew was the only Board of Health member serving at that time when that was done.
Compensation student.
I will send that.
I will any other additional board member comments? Hearing none, I will entertain a motion to adjourn.
Make a motion to adjourn.
second.
Been properly moved and seconded to adjourn. All those in favor say aye. All those opposed, motion carried. We are adjourned.
Whenever time you whisper, I can't